lecturer in veterinary anaesthesiology at Charles Sturt University's Veterinary Clinical Centre. And Chris is going to talk to us about pain management, anaesthesia, analgesia in horses.
Today I want to talk about why we need to sedate or anaesthetise horses, a little bit about how we go about doing that, and how we provide pain relief to horses when we have to do surgical procedures or when a horse suffers an injury. Horses often need to be sedated or even anaesthetised for various procedures. We often get asked, why does this have to happen? The thing is that horses are naturally inclined to run away from any dangerous situation. It's their survival instinct. And a horse that is frightened because it's confronted with an unusual or uncomfortable situation, and anyone who's ever been to a dentist or had to hold completely still while an x-ray is taken will know that that's not necessarily easy, even when we completely understand what's going on. Horses don't understand. They don't know that it's for their own good. So they're not going to cooperate, or even when they're really well trained, they can still react when they're frightened or placed in an uncomfortable situation. And some of these procedures will also involve, can be painful, and so we also need to use sedatives and other drugs that will reduce or prevent the horse from feeling any pain, to make sure that they're comfortable and not stressed. So one of the big questions is, what do we actually mean by sedation and anaesthesia? Sedation means using drugs that cause an animal to feel sleepy, they become less inclined to move, and many sedatives also reduce the sensation of pain. So they provide what we call analgesia, which is reduction in pain. What they don't do is make an animal completely unconscious. So horses that are sedated generally remain standing, they can still move, and they can still respond if they really need to. But they're much less inclined to react to strange or uncomfortable stimuli. And if we use drugs that also reduce pain, then they can be very comfortable when we need to do even quite complicated procedures. Anaesthesia, on the other hand, literally means complete loss of sensation. There's two types of anaesthesia. General anaesthesia, where a horse will become completely unconscious. So they will lie down, they will be completely immobile, they won't move even during major surgery, and they won't respond at all until the anaesthetic is actually discontinued and they start to wake up. It looks as though the horse is asleep. The difference is that a horse that's sleeping, if you touch it or make a loud noise, they will immediately react. Whereas an anaesthetised horse, we can do major surgery on it without any reaction at all. They don't feel any pain, they're not aware of anything that's going on. There is also local anaesthesia. What this is drugs that can be injected into or around a nerve to literally block the transmission of sensation like pain or touch up the nerve. So they stop the animal feeling pain from a specific area. Because it blocks the nerve, it's literally referred to as doing nerve blocks. We use these as part of lameness workups, but also for many minor surgical procedures, such as around the hooves or lower legs, and often up in the head as well for dental procedures or for stitching up minor cuts and other injuries. What local anaesthesia can't do, though, is allow us to do major surgery, like colic or correcting a fractured bone. Another common question is this safe for my horse? And that's not an easy thing to answer, because every anaesthetic drug, every sedative drug, every drug we use to relieve pain has side effects. And these side effects can have very complicated interactions, particularly in old or sick horses. So veterinarians are able to use these drugs safely, not because the drugs are inherently safe, but because they understand the physiology of the horse, they understand the nature of diseases that might be affecting a particular horse, and how other factors like exercise, aging, and conditions like pregnancy can affect the interaction between drugs, what's wrong with the horse, and what needs to be done. These interactions can be very complicated, and without training in both the pharmacology of the drugs and medicine of how horses work, we can't predict how these drugs are going to interact, and that's when they become dangerous. Essentially what I'm saying is that these drugs, although they're very useful, are very dangerous if they're used inappropriately. They are extremely dangerous if they're put in the wrong hands. So every veterinarian has had this training in pharmacology, physiology, and understanding the diseases that affect horses. They are the people who are trained to use these drugs safely. This ensures that your horse is protected, your legal rights are protected, and that you remain covered by both your insurance company and also protected by the indemnity insurance of the professionals working with you and your horse. So we have sedation, where horses are relaxed and able to comfortably stand there while we complete procedures that are important but not highly invasive. Sedation can also be combined with analgesic drugs to reduce or limit how much pain a horse feels. They can be combined with local anaesthetic drugs which block sensation, including pain, from specific parts of the body like the head or feet. However, for really invasive procedures, major surgery, we may need general anaesthesia. This is where a horse will actually be lying down, unconscious, immobile. They won't respond to any stimuli at all. This allows us to complete complicated procedures and also really delicate procedures where the horse has to be completely still and lying down. So when sedating horses, vets will take a number of precautions and utilise a wide amount of their training to try and maximise the safety for your horse. For instance, veterinarians will examine the horse prior to administering any drugs, and that allows them to select the safest or optimal choice of drugs for the procedure that needs to be done and the situation that your horse is in at the time. They use their knowledge of anatomy and the training they've received in veterinary school to safely administer the drugs. And even this simple procedure poses a risk if it's not done by someone who's had the proper training, because just below this vein is the carotid artery, the large blood vessel that carries blood straight from the heart to the brain. Injecting sedatives into this artery can result in severe side effects, including horses that fall down, seizure, and can even die if they don't receive appropriate treatment. In the unlikely event of something going wrong when a horse is sedated, veterinarians are trained to treat these emergencies, and they are also equipped with drugs and equipment that allows them to respond to any unexpected side effects. So sometimes horses require major surgery, and your veterinarian may recommend referral to a university teaching hospital or another privately owned referral facility. And if that is necessary, it's normally because the horse requires major or complex surgical procedures like colic or fractured bone or maybe arthroscopic surgery. And in these situations, the anaesthesia cannot be provided with simple injectable drugs alone, and the anaesthesia is also likely to be needed for a long period of time. By that I mean several hours. And in those situations, a lot more supportive care and equipment is required to look after a horse. When we actually come to providing anaesthesia for major surgical procedures, we use equipment like this. This is a purpose-built, large animal anaesthetic machine. It's designed to provide not only the anaesthetic gases themselves, which are delivered from these boxes here, but oxygen, and also through the breathing tubing to be able to support the horse's ventilation. So the machine incorporates a ventilator that can actually breathe for a horse should it be unable to breathe well enough by itself. This is particularly important in very long procedures. The machine has also got, sitting on top of it, monitoring equipment, which allows us to assess the horse's heart and blood system, and also how it's ventilating or breathing. And it allows us to adjust the anaesthetic on literally a moment-to-moment basis. When we need to anaesthetise a horse for major surgery, anaesthesia will be induced in an induction room, which may also provide the recovery room as well. Anaesthesia is induced with the horse normally standing and supported against a wall. There is a danger when the horse is going from standing to lying down anaesthetised that they can injure themselves or the handler, and this needs to be carefully controlled. both by careful administration of the anaesthetic drugs, but also by supporting the horse to prevent injuries. The horse comes into the room, is supported against the far wall, and then we follow this door, which is concealed in the padding, up against the horse. This is held along the horse's side, so the horse is standing along the wall and supported by the door, and then this allows us to have the horse lie straight down after induction of anaesthesia without any risk of injury to itself or to the handlers. From here, the horse is lifted up by an overhead crane and transferred onto the surgical table. During major surgery, horses are placed on a purpose-built surgery table. These are designed not only to hold the horse's weight, but also because they are so much bigger than small animals or people under anaesthesia, they need to be protected by providing a deep layer of padding so that their muscles are not crushed by their own body weight. From here, they are transferred into the sterile operating rooms where the surgery is actually completed. And then at the end of surgery, the horse will be brought back out into here, connected back up to the crane and placed into the recovery box. At the end of surgery, the horse is placed in a recovery room. These rooms are covered with padding on the walls and also have a soft, slip-resistant floor and firm rubber sides. This is to reduce the risk of injury during recovery from anaesthesia.
Well, that's pain relief in horses. It's been very interesting. So a big thank you to Dr Chris Quinn. Thanks, Chris.
Oh, you're welcome.
No worries.
Thank you for coming.
So for more information on horse health, make sure you visit equinedentalvets.com.